Good day to all. Myself Prachi Desai, first year BAMS student studying at Gomantak Ayurved Mahavidyalaya and Research Center, Shiroda, Goa. In this video, I'll be elaborating about the most common condition in females, that is dysmenorrhea. Now let's see what is dysmenorrhea. Dysmenorrhea is the medical term for painful periods or menstrual cramps. In addition to cramping, you might have other symptoms such as nausea, fatigue, and diarrhea. It's most common to have menstrual cramps the day before or the day you start your period. For most people, symptoms subside after 2 or 3 days. Mild to moderate menstrual cramping is normal, but some people have such severe pain during their period that it interferes with their day-to-day life and prevents them from doing things they enjoy. Medications and other treatments can help with painful periods. There are two types of dysmenorrhea: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea is the name for menstrual cramps that come back every time you get your period, but are not due to another medical condition. Pain usually begins 1 or 2 days before you get your period or when the bleeding actually starts. You may feel pain ranging from mild to severe in your lower abdomen, back, or thighs. The pain usually subsides within 2 or 3 days. Primary dysmenorrhea is the more common type of dysmenorrhea. And secondary dysmenorrhea, if you have painful periods because of a condition or an infection in your reproductive organs, it's a secondary dysmenorrhea. Pain from secondary dysmenorrhea usually begins earlier in your menstrual cycle and lasts longer than typical menstrual cramps. For example, you may experience cramping several days before your period, and the pain may last until the bleeding completely stops. Secondary dysmenorrhea is less common. Causes of dysmenorrhea. Menstrual cramps happen when a chemical called prostaglandin makes your uterus contract. During menstruation, prostaglandin levels are higher, which means your uterus contracts more strongly. This is the cramping and discomfort you feel. These contractions help shed your uterine lining, which is the blood and tissue that comes out of your vagina during your period. Prostaglandin levels rise right before menstruation begins. Levels decrease once you get your period, which is why cramping tends to ease up after few days. Now, why are period cramps so painful? What you are feeling is a tightening and relaxing of your uterus. The muscles in your uterus contract in order to shed your uterine lining. If you have painful periods, you may feel gastrointestinal symptoms, psychological symptoms, eliminational symptoms, and other physical symptoms. The gastrointestinal symptoms are loss of appetite, increased appetite, nausea, vomiting, anorexia, and gaseous distension of abdomen. The psychological symptoms were depression, excitability, irritability, inability to concentrate on work, and nervousness. Elimination symptoms were constipation, diarrhea, frequency of micturition, and profuse sweating. Other physical symptoms were lethargy and tiredness, headache, sleeplessness, increased sleep, fullness and tenderness of breast, feeling of heaviness in your lower abdomen, pain and swelling in the ankle and knee joint, and swelling of face. The picture depicts about a menstrual flow before and during period. How does secondary dysmenorrhea cause menstrual cramps? Menstrual pain from secondary dysmenorrhea is a result of condition affecting your reproductive organs. Conditions that can cause cramping include endometriosis, a condition where the tissue lining your uterus, the endometrium, grows outside of your uterus. Because these species of tissues bleed during your period, they can cause swelling, scarring, and pain. Adenomyosis, a condition where the lining of your uterus grows into the muscles of your uterus. This condition can cause your uterus to get much bigger than it should be, along with abdominal bleeding and pain. Fibroids, non-cancerous growth on the inside, outside, or the walls of your uterus. Pelvic inflammatory diseases. An infection caused by bacteria that starts in your uterus and can spread to other reproductive organs. PID can cause pain in your stomach or pain during intercourse. Cervical stenosis, a condition where your cervix narrows due to surgery, treatment, or other conditions. Congenital conditions, certain conditions you are born with can cause painful menstruation. This may include an irregular shaped uterus or other condition affecting your ovaries or fallopian tubes. Ayurvedic approach towards dysmenorrhea is the management based on correction of Apan Vayu vitiation. The site of Apan Vata is last part of intestine. Ayurvedic healthcare provides the classical treatment which is explained in Ayurvedic scripture, that is Panchakarma. Snehan, the oleation therapy, massage with medicated oil or ghee, Shatavari Grit, sesame oil, hot water bag, fermentation, Nadi Sveda, highly helpful in painful condition. Virechan, medicated purgation therapy, used of laxative like Gandharva Haritaki. Basti is anema therapy. Its best treatment for the vitiation of Vata dosha like Uttar Basti, decoction Basti and Matra Basti. Thank you.